Now, you may have heard that the benefits of taking the cholesterol-lowering drugs known as statins outweigh the harm that they can cause. Well, a group of scientists are asking for the raw data to prove it, claiming this is not evidence-based. Well, joining us to discuss this controversy is the cardiologist, Dr. Aseem Molhatra. Very good morning to you.
Morning, Isabel.
What's your view on all of this? Are we being misled about how effective statins are?
Well, I think there are major concerns about the reliability of the original data that has driven guidelines and driven millions of people around the world to take statin drugs. And one of the reasons that is that this information has been held in strict confidence, if you like, commercially confidential, based on predominantly industry-sponsored studies by a group in Oxford University who, have received hundreds of millions in research funding for those trials. And what we've done by writing a prescriber journal with myself and a few other international scientists is look at the actual data after other cholesterol-lowering drugs, dietary trials that have reduced cholesterol. And interesting, they haven't shown any significant benefit, which makes you wonder how statins benefiting people. It may be through a separate mechanism, through anti-inflammatory mechanisms, but there are a lot of discrepancies, and there are enough discrepancies for us to at least ask that we should get access to this raw data so independent researchers can know who truly benefits. But what's really important, Isabel, as well, is even looking at the published literature, the reality is most people taking statins are not going to benefit. There's going to be a small number of people who benefit, and that's part of how we have dealt in medicine for many years, treat many to benefit the few, but most patients don't know that. So, for example, if you're otherwise healthy and you have a low risk of heart disease, taking a statin will not prolong your life by one day. And even if you have established heart disease and have had a heart attack, and I've treated thousands of people in my career with heart disease and prescribed statins, even in those people, there's a small number that benefit. So we have to be more transparent with patients as well.
Okay, so there may be a few that benefit, but what are the sort of side effects that actually a lot of people will be sitting at home going, okay, it sounds like I'm not high risk, I don't necessarily need to take these. Are there actually, downsides to taking statins?
I'm glad you've raised that point, because that's where there's been a great controversy as well. And the original data suggests very few people get side effects. Maybe 1 in 100, 1 in 200 get significant muscle pain. In my experience and looking at other data, it's likely to be much higher. Most doctors, GPs, grassroots doctors know that these side effects, which specifically are things that wouldn't necessarily serious or life-threatening, but interfere with the quality of life. And classically, it's muscle pain, muscle weakness, fatigue. And actually, some data suggests independently that this may be affecting up to 29% of all people taking statins. Now, this is often reversible. And even improved on lowering the dose of the statin, but that's a huge discrepancy from the original trial data, which suggests maybe 1% and 29% in the real world. So that's another reason why we have to access the raw data, because there are millions, possibly 100 million people taking this drug worldwide, and we still, after 30 years of them, original trials coming out and prescribed, we still don't know what the true benefits are and what the harms are. And that, for me, actually, I think is pretty outrageous.
Okay, one final point, though, is obviously they're very popular, not least because, you can treat a lot and hopefully help a few, but they're cheap. And therefore, tempting for cardiologists.
Yeah, sure. And I think, in a way that's a good thing, but I think what's important is being transparent with patients so that they can make informed choices about whether or not to take the drug, and we need better information on that. But what's more interesting as well, Isabel, is there is a huge drive for newer cholesterol-lowering drugs coming on the market, and a multi-billion-dollar industry here, and there isn't any evidence at the moment that those drugs have shown outcome benefit in trials, that they prevent heart attacks, which again raises many questions about the whole cholesterol hypothesis. And one final point, I was involved in some research that showed if you're over 60, LDL, the so-called bad cholesterol, is not associated with heart disease and is actually inversely associated with death. And that's partly because we've just focused on heart disease. Cholesterol is a very vital molecule in the body, involved in neurological function and the immune system as well. So I think we need to think a little bit more differently about this approach to heart disease management.
So good to talk to you. As always, Dr. Aseem Molhatra, thanks very much.
Thank you.